Okay, so good morning, everyone. Welcome to the regional LPC meeting. This is our third one of the year. I will just say we can quickly go around and do some introductions because there are some newer faces here. I will start. My name is Daniela Arias and I'm one of the program coordinators here at the Hub. Guess I'll pass it over to Caitlin.
Azure Rojas?
Yeah.
I don't have you.
Diamond, can you please mute yourself? I don't have the control, so sorry. I would have just.
Can you hear me?
Yeah, we can hear you.
My end said it was mute. Hold on.
There you go.
There you
Okay, thanks, Diamond. Good morning, everyone. My name is Caitlin Common. I'm a program coordinator at the Hub. I'll pass it to Giovanna. Do you want to do an intro?
I actually don't know. Two people, actually. So Giovanna Mozo, director of the Hub. Thanks for attending today's meeting. I always forget. Ingrid, take it away.
Hi, everybody. The hat I'm wearing for this meeting is I'm the coordinator for Region 1 Gambling Awareness Team.
You want to pass it on?
I'll go. I'm Ellen Brzezowski. I'm from Greenwich Together, and Stacy.
Thank you. Morning. I'm Stacy Walker. Happy Friday. I am New Canaan Cares. I am responsible for the New Canaan Coalition. Thank you.
Good morning,
Judy.
everyone. Melissa McGarry, TPOD Trumbull's Prevention Partnership. Kathy?
Good morning, everyone. Fairfield Cares Community Coalition. And who hasn't gone? Chandra.
Hi, Chandra Ring from Wilton Youth Council, and Melissa.
I just went, but I'll pass it over to Allegra.
Hi, I'm Allegra Erickson. I'm from Thriving Youth Task Force in Darien, subbing in for Emily. And Judy.
So good to see you, Allegra. Hi, I'm Judy Phillips. I'm also with New Canaan Cares.
Who else? Ina, do you want to go?
Hi, I'm Ina Anderson, BUC, LPC, Bridgeport.
Thank you. Diamond?
Hi, I'm Diamond with the Norwood Partnership in Norwood, and I'll pass it to Tammy, Tammy.
Hi, everyone. Tammy Trojanowski from Stratford Partnership. I'm just jumping on, so I'm not sure who I should pass it to. So if someone could fill that in for me, that would be great. Thank you.
I think it's just Margaret. She did say in the chat that she was in the middle of something. But that's Margaret Watt, and she is from the Westport Coalition.
Oh, sorry, I actually didn't go, but I'm Victoria O'Neill. Sorry, and I'm a program coordinator here at the Hub. Thank you. Sorry about that.
Sorry, Victoria. Didn't know. Okay, so I'm going to pull up the agenda. We do have a lot to cover today. Can everyone see that? Okay. So just some housekeeping things for LPCs. I did just send an email before this meeting that demographic forms are due by next Friday, April 15th. I know that's Good Friday, so whenever you have them available. Our next meeting is also going to be our end of year presentation with everyone, and that'll be Friday, June 3rd, probably at this time from 10 to 12. Final reports will be due by July 1st. There is going to be a new document which we'll send out shortly. I'm hoping that'll be easier to complete this year. Giovanna, do you want to speak quickly about logos?
Just want to reiterate that any LPC funds that you use or SOAR dollars, that whatever the event is, and if you're creating a flyer, you want to put the Hub's logo on it. It's optional to put Demas. You're welcome to put both, but I know sometimes all of you collaborate with many different people. So just to just be clear, the Hub's logo does go on. If you need the Hub logo in a higher resolution, please let me know and I can send that out to you.
Great, thank you. And now we'll move into some updates. Ingrid, I know you have to go shortly, so would you like to give a problem gambling update?
Sure. So for those of you that don't know, we have a regional gambling awareness team covering the communities from Bridgeport to Greenwich. And our ultimate goal is about increasing gambling awareness amongst all of the groups. This year, we were super busy. March is Problem Gambling Awareness Month, but with the legalization of online gambling and sports betting, there's been a real increased interest in that. So I just want to highlight some of the ways that you might be interested in being involved. Number one, we have our regional meeting. Our next regional meeting is a Zoom on Tuesday from 2 to 3:30, and we're going to be highlighting some of the key points, things like that came out of PGAM. Kathy Hazlett comes to those meetings, and sometimes Tammy's able to come. If you want to come, just check it out. Just email me and I'll send you the link. The other thing that we're doing, we have a new prevention coordinator for the last year who was actually for many years head of an LPC up in the Southington area, Kelly, and she's put together, Kadka's going to be coming out and doing 4-day training, not all days at once. They're spread out from 9 to 1. And each region, there's 5 of us, will pull together a team, 6 to 8 people that has prevention, treatment, and recovery on it. And really it's about using the SPF model to be able to help develop an action plan and awareness around what the gambling awareness needs are. So if you want more information on that and might be interested, love to have you involved with that. Next year, every year, youth are involved in, have the opportunity to create a PSA of any sort. This year, we had 9 teams from across the region. Our team that we've typically worked with is Caribe out of Bridgeport, and they won most creative. So that was pretty exciting. But again, I'll keep you updated because it might be a way that your youth are involved. There's some really good ways that youth can be involved, and there'll be an honorarium provided. And then CAP. We have it's CAP, C-A-P. It either stands for Congregation Assistant Program Training or Community Awareness Program Training. It's a 3-hour training. It can be virtual, be broken down into 2 1.5 hours. It can be for any group, congregations. I've done it with youth teams, etc. And what you have, it covers drug trends 101, substance use. We do a needs assessment, a very quick couple questions ahead of time to see what specific drugs people want to know about. Covers mental health 101 and gambling 101, and it's very interactive. We've gotten great feedback, but that's another way that your LPC may be interested in hosting a CAP. I know that Trumbull did it a couple of years ago, and we've done one in Westport, but I've done it a couple times with the Ram Council youth teams and some other groups. So there's different ways that you could become involved if you're interested, or you could, like Fairfield Cares and Margaret with Positive Directions just hosted a Gambling 101 presentation, and it was well received in both of them. So I just wanted to highlight the different ways that you could become involved. And thanks, Daniela. That's it on our end.
Great. Thank you, Ingrid. Does anyone have any questions for Ingrid? Okay. Next on the agenda, I have Caitlin with the CACs, and she has some updates.
Thank you, Daniela. Hi, everybody. So the CACs, or the Catchment Area Councils, are going well. We've been meeting. Each meeting we have presentations, exchanging resources, updates, doing lots of legislative work. So we will be meeting next month. We had a legislative forum based on our legislative priorities that we found through our CAC and our CAC members, and just a lot of great work happening that I've been doing with Daniela and Ingrid, our CAC co-chairs. So thank you, ladies. And just some updates with what's going on next month is we are in the very early stages of planning a lived experience panel. I don't want to talk too much about it because we are still figuring all of that out, but more information will be sent about that shortly. But what I definitely do want to give an update about is our mental health highlights initiatives during the month of May, which is Mental Health Month. So we want to feature and highlight different individuals throughout our region, whether a professional working in the field or a person with lived experience, having them submit a blog or journal entry or doing a short video. And we want to just highlight that their experience or their efforts in our newsletter, social media, and such. If you would like to submit a highlight for yourself or your work, or know someone that that might be interested in submitting a highlight, please email me. And then we have a few lunch and learns coming up. April 18th, we have an LGBTQIA+ lunch and learn. So we'll be talking about statistics and what's going on in this community in our region in terms of mental health, suicide, substance use, and then just some basics of how to be an ally and how to be inclusive in your work. And then May 24th, we have Understanding Suicide in the Elderly in America. And that one has continuing education credits offered. Any questions? Margaret, I see a little hand up.
Hi, yeah. Just in terms of the lived experience and like trying to feature people from the region, I wanted to let everyone know. So Mental Health Connecticut is doing 30 stories, over 30 days during the month. And there are at least 3 people from our region. We got Allie, Sue Bucksbaum, and I think Nicole Hampton as well, that are all going to be among the featured people. So my dog started like screaming in the middle of what you were saying, Caitlin, so I didn't totally get it, but I was like, it sounded like what you were trying to put together was pretty similar to what they were doing, and didn't know if you wanted to kind of just like, I think their goal is really that everyone in the state would be resharing and reposting like the daily stories of Connecticut people dealing with mental health.
Exactly, yeah.
So
yes, so we were actually talking about that, Daniela and Ingrid and Giovanna. We were all talking about it, and then I saw that email that they were going to start that initiative. So just kind of came together, but very similar to that, just featuring and highlighting kind of the underdogs of people or people doing work in our region, so that can be shared out. So yes.
I'm sorry, Margaret, Margaret or Caitlin, who sent that email?
So the one is Susie Craig. If you're talking about the Mental Health Connecticut initiative, that was from Susie Craig, and I forwarded it to various people in the region because they only wanted 30 stories, but they wanted a variety of stories from around the state. And their goal would really be that all of us would be sharing those every day, right? So it sounds like if you're trying to focus the regional one on something a little different, then we can still support that statewide campaign. But for anyone who doesn't want to recreate anything else, there's that.
And they're going to be videos?
Yes, so they have like everybody got a professional headshot. They got recorded. It was like a big thing. Like they all, I don't know, like Sue Bucksbaum was all excited about like that, they got interviewed for like a half hour and whatever. And I heard about it from her and Allie a little bit, so.
Oh, all right. Well, that's good, because then I know Caitlin mentioned too about anyone that has the lived experience. If you want to submit a blog, for those that, everyone should be getting our newsletter, but if not last week or the week before, we highlighted someone in our region who has lived experience, and she was able to tell her story through our newsletter. So it was a really nice article that she wrote. So we could do blogs too, just to highlight, I think, in different aspects for those that, view things differently. So blog, videos, we can definitely support the statewide campaign as well.
While we're on that topic, I could just add in that turningpointct.org, which hopefully everyone is familiar with, which is our statewide youth and young adult, online mental health peer support website. They're, in addition, all their blogs and podcasts and everything else, they're doing one of their quarterly newsletters that'll be released in May. So it's really focused on Mental Health Awareness Month and some prevention stories in there, but that's all generated by young people in the state with their lived experience.
Great. Thank you for sharing that, Margaret. Before we move on to Victoria, Ingrid had one more update.
Yeah, sorry, it's about Match mobilizing against tobacco for Connecticut's health. Exciting news legislatively is that this year we worked on a bill to advocate for funds to be consistently put into the Tobacco Health Trust Fund, which is our main source for prevention and cessation. Connecticut always ranks either last or second to last in terms of how we use it. It's the tobacco master settlement dollars and tobacco tax dollars. I'm excited to say that we got further with that than we've ever got in many years, and appropriations, we got it out of Appropriations Committee. They literally just included the language in their state budget that says we want $12 million per year, and it's not may recommended, it's shall. That was a big step for us. We said it had to be mandated. So it's Senate Bill 399. And so right now what we've been doing is talking to members of the Finance Committee, some of which are on this committee. But Lucy Dathan was really critical in the Appropriation Committee work on that. So I can give you more information if you want to reach out and thank her. She was just amazing. But we have other members. So that's exciting because we just never get it consistent and that, but we are not fighting. There are some unfunded mandates obviously with the state this year, and there are some people in the Finance Committee I think that are very hesitant. They want to make sure that those things are funded, no dipping into the rainy day fund. So this is mandated, dedicated money. So I just want to let you know, and I can send further updates because if you know any of these people on the Finance Committee, some of which I know you guys know, it's just a quick call to see where they stand on this. But for us, that's very exciting. We haven't got that far in years. So thank you for letting me share that up.
Thank you, Ingrid. That's great. Next, we have Victoria to discuss a little bit about suicide.
Okay, so I know I already introduced myself, but I know that there are a few people on the call that I actually haven't formally met. So for those of you who don't know, a lot of my work here at the Hub surrounds suicide, and that includes trying to coordinate and head our efforts surrounding the Regional Suicide Advisory Board. So before I get into some of the other points, I really do want to encourage all of the LPCs to attend if you're at all able to our RSAB meetings. They're really great meetings. I know the next one will be our Hub end of the year kind of in review. But just going forward, I think it would be great if all of our towns could attend. Anyways, with that said, we are compiling a bunch of resources into a suicide private page. It'll be very similar to the LPC private page, just have a bunch of resources and information surrounding prevention and postvention as well. We also have a upcoming Lunch and Learn, which will be on May 12th. So it's actually taking place during National Prevention Week and month, I guess, but I'm super excited about that. We're partnering with the VA and we're having a suicide program coordinator with the VA come and talk about the interrelationship between veterans and that kind of combat experience, and then ultimately suicide as well. So relating to mental health and suicide, it's a really vulnerable population that should definitely be discussed. So like I said, that is May 12th, and it's from 11:30 to 1. She said typically the training itself is about an hour, but there's usually conversation that follows. So we kind of allotted an hour and a half for that as well. And then we are also offering a smart recovery group this month with Norwalk Community College. So I will be there every Wednesday from 1:30 to about 2:30 or 3. And we're really hoping, like I said, it's only Wednesdays and kind of like the middle of the day, but we're really hoping to promote that and get a good turnout for that as well. And yeah, I think that's it for updates for me, unless anybody had any questions.
Victoria, can you say who you think should go to the Veterans Suicide Lunch and Learn? Is that more like for behavioral health providers, or like, would that be like VFW American Legion people? Is it more like how do you support your peers, or social services or seniors?
Yeah, so it's definitely open to everyone. I'm really hoping we get a great turnout because this is a population that I have firsthand witnessed is really at, like I said, vulnerable, but it is more targeted towards those behavioral health professionals. And I'm going to do specific outreach to everybody in our contacts who kind of falls under that category. But like I said, it's definitely open to everybody. I don't want to kind of close the door off to people who may be interested because I want everyone to be welcome to that as well. So hopefully that clears it up. But thank you.
Yeah, because I was just wondering if it was more like awareness or like skills and like what should you do, you know,
Yeah.
for, yeah, thanks.
Great, thank you, Victoria. Next, I did put legislation on here. I know Ingrid spoke about a little bit of that, but I know it's a short session and there's a lot going on, but I did want to highlight and say thank you to all those who did participate. We've received so many emails. We testified ourselves. We're hoping to see some good outcomes, but we'll see.
Could I just throw something in on legislation, Daniela?
Yeah, absolutely.
I mean, I know there's been so many different things that we've all probably testified on, but one of the ones I wanted to highlight, because Giovanna, you sent out that email to everyone about the RBHAO bill and asking people to kind of support that. So just to give everyone some of the politics of that, that bill was like 28 pages long, and Demas buried some.
Can you not involve politics?
Well, I want it because there's
I'm
been like
kidding.
change up to yesterday on that. So the thing is, they called that bill a bill about the RBHAOs, but buried in there, it was a 28-page bill. So I was like going through it the day before the testimony, and it was like, oh, there's things that they're sliding through. So the big one that concerned a lot of the behavioral health advocates was that they were specifically removing anybody with lived experience from the state board, which is the ultimate like committee that's supposed to guide the, you know, DEMAs. And the state board has traditionally the statutes have been written so that there would be multiple people with lived experience from every region that advised the DEMAS commissioner and sat on the state board. So that bill, if you read the description of it or the title of it, you would not have known that was in there. It was buried on like page 14. We raised significant concerns and said, you have to change this part. The people with lived experience were all deleted from the bill and replaced by 2 psychiatrists, which you can imagine would kind of upset people. So there was a lot of testimony on it that day. They still passed it out of committee. And since it was going to the floor, you know, it's supposed to go to the floor this coming week, literally in the last 2 days, there was like a giant kind of statewide letter campaign, and people call, you know, you guys wouldn't necessarily have seen it unless you were on those chains, but there were a lot of calls, and through Twitter, primarily, the legislature finally is addressing that. So I just wanted to mention it. It's where even when things pass out of committee, you can still make a difference. And also that, you know, the bills aren't always what they say on the surface. There's like a lot more other stuff in there that we have to go through when we're testifying on stuff. Because I'm actually the one who found that part of the bill and started letting people know the day before the testimony. And a lot of us put it in our testimony and they didn't deal with it. And we sent letters afterwards and all of that. I'm very disappointed in Demas over that, I will say. But with enough pressure, they're fixing it.
And I hope that they do fix it. You know, in my state meetings and talking about the RBHAO bill, I made it very clear that I wasn't comfortable passing this, and it wasn't correct. The things that are in that bill, we don't even do.
Oh, yeah.
CACs didn't even do when they were mental health boards.
Right, not recently, right? There were so many things, but that was one piece of the bill. There's also stuff in there around like people who are being discharged from the hospital, like what do their nurses have to do? That bill covered so much stuff. It's honestly them being a little sneaky. So we have to watch out for, right? Sometimes it's like they are trying to put a whole bunch of things in one bill and hope people aren't noticing it because it's not even in the description.
Yes, and so, with that said, and talking about politics, it was encouraged that we keep the bill the way that they had it and move forward so that then next session we would be able to amend it the way that we wanted it to be. And of course, like Margaret, I'm very cautious when it comes to Demas and making sure that, what is right, what is wrong. But with Mary Kate announcing her retirement, that kind of scared us all because she really is an advocator at heart, especially when she comes to, to our meetings and talks about the bill and everything. So with that said, it was kind of like, oh, well, if the next person comes in, maybe they're not going to be RBHAO cheerleaders, and maybe we won't be in legislation, which then means Demas could do whatever they want. So we were just trying to make sure that we just get into legislation. So really our backs were against the wall in the sense, and I know that it shouldn't be, but unspokenly they were, because of the situation of Mary Kate being retired. So thank you, Margaret, but I felt like I needed to address that so that you all know that when I do go to these meetings, I am talking and I am advocating and I am raising points not only to the state, but also to my counterparts. They have not announced Mary Kate's replacement. They're looking for someone per the commissioner. And they're hoping that they find someone soon so that Mary Kate can at least show that person the ropes prior to her retirement. So they're hoping at least 3 to 4 months prior to her retirement, someone is gonna be in place.
Is that Mary Kate Mason who's retiring?
Yes.
And she came out of the prevention unit. She was in the original group of people that worked with us who had SPIF SIG grants in 2006. So she always had kind of that perspective. So that's disappointing.
Exactly. So that's why we really felt like she understands prevention, right? She gets it. I think after a while of when you go into the state world, you forget about what's realistic and what's not, right? But yeah, it was upsetting to hear that. But happy for her, of course, but it is what it is. Would you like me to go into the SOAR, Danielle? Sure. All righty. So SOAR, please tell me everyone received their checks for those that were granted. Okay, just double check. All of that should have been out and to you months ago. We are doing naloxone training twice a month on Wednesday, first and third, from 3 to 4. For those that are doing recurring naloxone trainings as well, if you'd like to let us know, we can add you into the flyers so that we can at least promote that training as well. I think that the more trainings we have, we build capacity within our region, and that's of course great. Just so you know, I did my monthly report to Demas yesterday, and we gave 295 kits last month to our region. 295. And that is first responders, community at large, prevention coalitions, you name it. We definitely were busy last month with naloxone training. So people are still wanting and needing it, that's for sure. SOAR application, as everybody knows, the contract, Ed, does somebody have a question?
I have a question about Narcan and maybe actually more comment too. Giovanni, you and I were talking about those of you working with your EMS, they just got, I guess, permission to leave Narcan, or guidance to how to leave Narcan kits at the homes where there have been suspected overdoses. I can share what they got. And of course, they have no funding for the Narcan kits, but they were told that if they do respond to a household where they think there's been an overdose, they can leave Narcan kits. Or if someone's used Narcan at the plate, you know, if the family members use Narcan, you can replenish their Narcan, but they haven't been giving any guidance on how to get the Narcan kits. So Giovanna and I were having some conversations, and you have some information from the state on that, right?
Yes. So it's interesting how everybody has their hands in certain things, okay? And Louisa Barnett is the director of treatment and recovery when it comes to the SOAR contract, okay? So she is the person that oversees all of SOAR for the state of Connecticut. However, she only oversees the grantees related to mental health and recovery. The Demas Prevention Unit oversees us with the SOAR prevention piece of it. So when I asked her to meet with me to talk about roles and responsibilities, because I felt there was a disconnect. And it was a nice conversation because I was able to find out that she actually orders our Narcan and sends it out to us. And when I was talking to her about Narcan and how some of the first responders sometimes reach out to us and say, hey, we need 50 Narcan kits or 100 Narcan kits because my kits are about to expire. She then said that they can directly go to her and request for kits, and she would order them. So if anyone in your community that is a first responder is asking for kits, and to you first before us, please let me know, because then I will give you Louisa's contact information. Now, the problem with her is that there's a 2-week wait limit, okay? So if you had an uptick in overdoses, I don't expect you to go through her and wait 2 weeks. I want you to then come to us so that we can replenish their kits. And then I will deal with Louisa on my end to see if we can get those kits replenished. Because I want to say 80 out of the 295 last month went to first responders. 80. So that's a big chunk of our kits, and now I have to request more from Louisa because we're under 150. And I don't know I don't know what's going to happen. So I want to make sure that I have enough for all of you. So with that said, in regards to Melissa and the and EMS being able to leave a kit at someone's home who was suspected to have an overdose, we're willing and able to provide those kits, you know, if there was a couple. If there is a big quantity, then that's something that you want to talk with Louisa and possibly even just do a very quick 2 to 5 minute administration of how to use the kit. Because Demas's kits per prescription states we have to educate the individual who's receiving the kit. So as long as you do that, or EMS does that within 2 minutes, 3 minutes.
The protocol explains that they need to leave behind information on how to administer I guess the question is, we need to make sure what EMS is being told kind of reconciles with what we can help them with. Because if it's a particular guidance, they need to leave like a kit with the family. So I don't know if you can download it. I tried to put it into the chat. If you can't, I'll just email it out. It came through Facebook from a private Facebook group. So it's possible you might not be able to download it, but I can send it to the group. But I guess it gives a lot of details on but of course, no money, right? So here, you can do this. This is wonderful. And I think it's I think it's a very valuable tool, right? Because they're responding to households with suspected overdoses or with confirmed overdoses. So those are the households and locations that are more likely to need the Narcan. It's just, how can we support our EMS who are already like tapped out with COVID? So I'll send it as an email so you all can see it. But I was wondering if anybody else's EMS department raised that.
Well, Westport EMS wasn't talking about that, but raised the fact that they are now, for certification or recertification, Giovanna and I talked about this, they're required to have a 2-hour suicide prevention training, which can be, I'm actually looking at the document, it can be either QPR, but it has to be 2 hours. Usually that's 1.5. Or it can be an OEMS approved PTSD and suicide prevention training. So that's also something new. I mean, the hub just finished trying to offer all these QPR trainings and assist to EMS for the last 1.5 years because of a grant that we had gotten. And now they're like, now we need a 2-hour one. So I'm doing one for Westport EMS next week. And then Mark Blake from Westport EMS chairs all the EMS in the region. So he's probably going to start bringing them in for that. It's also an opportunity to give them Narcan at the time of the training, Giovanna, if they need supplies.
Yes.
I mean, with what you're saying about Louisa, should they be just going to her directly and like she gives some to them and then she gives some to the hub, and like, because otherwise it sounds like it's a little bit of, sometimes they come to us or you, or sometimes they could go to her.
So I think it's 2 things. One, how quickly do they need it? If they can wait 2 weeks, sure, go through Louisa. But then the second thing is, I guess we have to train someone in that household. That's my hesitation, because I don't want someone to have a kit and then come back and say, well, I didn't know how to use it. Nobody showed me. Or, you know, and not to say that somebody won't say that anyways after being trained, but I'm a rule follower,
what about
I
if we
guess.
make
And
sure
at the
everyone
end of the
has-
day, I'm a rule follower, and per Demas's doctor's order, we have to train the individual. And the doctor order says 15 minutes. I'm just talking about a 2 to 3 minute window of training somebody. So how can we get that done?
Well, and what if we did like a really quick and dirty training, but we left like a card with pictures, because there is such a thing, and that just kept that with the kit. So, I mean, it doesn't take very long to explain how to do this stuff, right? It's not the old kits where you had to like twist together and assemble it, like this is just point and squirt, really. So I think we could figure out a workaround. I mean, you can't expect your EMS to like hang around and do a training while they're trying to transport someone to the hospital, right? I mean,
No.
it feels unrealistic. It feels once again a little like unrealistic in the field.
So Melissa, I was able to download, and thank you for
Yeah,
sharing.
I just emailed it. I just
information.
emailed it to everyone.
Yes,
So
thank you.
I sent it to everyone who's, even the people who aren't even here, so.
So where do the other ingredients of the kit come from? So it includes the CPR, face mask or shield, a card to explain how to use Narcan. So where do those other pieces come from?
There's no guidance on that. I mean, I would assume some of us could do that with our SOR dollars this year or next year if they're still SOR, or prevention money that you have. Otherwise, it's got to come out of your town budgets if you're going to do it, out of your EMS budgets. It's another unfunded program, right?
Well, also, but in terms of like the piece of information, I mean, in every kit, when you unfold that thing, it's pretty clear and pretty obvious. So I don't think anyone needs to. I mean, I don't know if you saw, if they're supposed to do a 15-minute training, what I put in the chat is like, can we just have whoever EMS or whoever is there, like, give them the link. Here's that little video, right? If you watch that whole video, it's 8 minutes. It walks you through signs and symptoms, how to do it. It's very visual. And then you're like, open the kit, unfold the paper, look at the paper. Here's your paper. Here's your resource guide, connect with Live Loud, whatever. Like that would take 15 minutes, but it wouldn't actually mean that the person on the scene had to do anything more than like press play on the video and hand them stuff and open up the packet for them.
True.
Yeah, so I think that I think we need to figure out how to be able to support the EMS for at least for those that are wanting to do that, right? Not all EMS departments are probably looking to do that. I know, Trumbull would like to do that. And I would be happy to, give you 5 kits to see how it goes for the month. If maybe do a pilot of this and see how it goes.
Yeah, we can do that. And we can report back with,
Exactly. Yeah. Because the other thing is too, we have to report to DEMIS every month how many kits were given out and to what stakeholder. So and that means Melissa, so if EMS left a kit to a family, it would be a person who it would be what is it called? Which one is it, Victoria? Can't think of the name.
Like prevention and recovery, I think. Right?
Yeah.
So I would need to identify who got that kit.
Yeah, and if you look at the guidance when you get a minute, it actually requires them to track a lot of information. Like it actually asks them to like what the kit number was stuff we don't even track. Like, what the kit number was that they gave out, details. So it actually requires more from the EMS than we typically require of an Narcan training. So it would be no problem getting you the detail you need. Yeah, they ask for a lot.
And then the last thing that was interesting that I had a conversation with Louisa was, so expired kits. What do you guys do with your expired kits?
We use them for training.
We keep them in a bag. I don't know what to do with them. It's tucked away safely.
Can we take them to
There's
the
no right or
medication
wrong answer.
disposal? Can you take them to the medication disposal box in your community? No, they won't take them?
They don't like liquids, but you could probably put them in there.
Yeah, I don't know if they'd know.
Exactly.
Sorry, but can you just throw them out? I mean, that's the other question. Can you just throw them out? Because apparently they're not dangerous, right? So.
Yeah. No, we do use them in our Narcan trainings, like so people can actually feel what it feels like.
It's a good idea
to spray them.
So what from my conversation with Louisa is anyone that if you have a protocol in place, say for example, police department, right? And I've told police departments, I don't want the kids back. Do whatever you want with them. However, clearly I wasn't thinking right because she then says, if someone like a police department has a protocol and says 3 months from the expiration date of the kit, if they contact me and tell me, oh, my kits are about to expire within 3 months, I could have or should have been asking them for those kits back to then be able to disperse them to treatment providers that actually work with those that are struggling with substance use disorder. So that because the turnaround for them is quicker than for us.
So say that again.
I
You're
know,
going to take
right?
back the ones that are going to expire within 3 months and give them to like Liberation Program or
Exactly.
so they can use them within that 3 months. Is
On
that what you're
demand.
saying?
Yes.
Okay, got it.
Yes.
I love that idea. It's just a lot of.
Nothing more drove me crazy than people telling me, oh, my kit expired, or not even 1 or 2. It was at one point, department said 120 kits expired. I got a problem with that. So let's talk about, do you really need 120 kits to be replenished? And I'm not, I'm not here to say yay or no, or, like, you need it, you got it. But 120 kits at one point, and they wanted to replenish every single one. No, can't do that. Give you half, no problem. But 120 kits. So, and I thought that was a great way to recycle them, right? And be able to, yes.
I'm sorry. So you guys don't keep those kits and use them because even though they're expired, they're still good?
So we are recording, but officially, yes. We cannot give anyone expired medication, even though in our minds, we know that it's not going to be as potent, but it may work, right?
No, the reason why I asked is because we were told by DPH at GBAP that those kits were still good.
Wow.
That even though the expiration date is on the box, that those kits are still good for another year. And so, okay, I'm just saying. Thank you.
Ina, is it possible that they said, you know how like they changed like, was it a year ago that they told us all, oh, they're good for longer and they're going to change the expiration date on them? Could they have been talking about the ones produced prior to that date and they're like, oh, those ones are good longer?
All I know is that whatever the expiration date on the box, that they still have a shelf life of 1 year. So whatever from the date that they expire, and not that we keep them that long, but this is what we were told. So that's why I'm listening and I'm going, wow, so you guys replace those. And okay. I mean, because if you say replace them, then maybe they should be replaced, or as they are coming upon expiration, then pass them on so they can be used. The thing is nobody likes to use stuff with expiration dates on it, and you really don't want to give that to the public because they don't understand. When they see something expires, they think it don't work, it expires. So I get it. But we were also told that they do have a longevity. So, okay.
Thank you. I was also told that. In the beginning, when we've had our first SOAR 1 and 2, they were talking about that and how, you know, if it's expired, you can tell people to, you know, they can still have it within 6 to 12 months after expiration. The potency may reduce a little bit, but it still will revive somebody. And then DEMA said, no, we cannot say that. And that's where we're at. So that's why so interesting that you say that too, because LIB is also funded by DPH, and maybe that's why Louisa already knew that to give it to a treatment provider, and she gave the example of Liberation, because they will be able to take it off your hands and be able to use it to someone, give it to somebody else that may need it. But officially, no, we cannot give anyone expired. We cannot train somebody and give them an expired kit. Whatever people do afterwards, that's not my problem. That's not any of our problem. So I think, Melissa, to be continued. Let's talk a little bit more about EMS and maybe even just do a pilot with Trumbull and see how it goes.
Yeah,
I'm willing to do that.
Okay, we'll talk further.
Great.
I just wanted to say on the Narcan training, I was just really happy because Margaret sent me an email that one of the Norwalk, was it a nurse, had spoken to a New Canaan public school nurse and was looking for Narcan training. So Margaret sent her to me, who I know, and Danielle is going to be doing the training for 10 nurses at New Canaan Public Schools. So I just appreciate the camaraderie and, you know, being able to give this to the community, because Danielle, in the exchanges with the emails, one of the nurses said, funny, I train, you know, do this training as well. And Danielle said, oh, should I invite her? But then I think we come to realize is they're not going to get their stuff for free. You know, you provide them with the Narcan and they get it. So I think it's just such a wonderful opportunity for the schools to have this. I mean, I was just talking to a police officer the other day, and they went to an overdose call and had to administer 3 doses of Narcan. So
I will add on to that too. We've always had resistance to training our school nurses. And I think with the recent rise in fentanyl, we trained every one of our 22 nurses last month, and they had never been open to it. So now the school security want it, like we're a lot more interested. I just trained 15 people at St. Joseph High School in their support staff. And so reach out to your private schools too, because they're open to it in a way that probably they haven't been.
Yeah, we were able to so our nurses in Norwalk have been trained to pass by us, and then we retrained them, but this time around that we were able to get all those security guards as well. And they were like, oh, no one's ever given us training on anything.
Mm-hmm.
Yes.
Is anyone having issues or at least pushback for Narcan training to nurses or to their district? I know that I reached out to all of the superintendents in our region, and I got a couple of responses, but I feel like then the superintendents reached out to you guys, which was fantastic, because you can reach out to me. I offered to do the Narcan training, and then I started hearing that Margaret was doing some training, and then Melissa, and then Daniela telling me about New Canaan. So I was like, oh, this is great. So maybe there's still internal conversation from that email I sent. I don't know, but for Bridgeport, I actually got pushback out of all towns. I got pushback, but I think now we're moving forward because the whole thing is that you have to make sure there's a policy and procedure in place, right? And that's my first question to anyone that is asking to do training, a staff training. Does your staff know, where to get it, how to get it? Is there a protocol? Do you have to do a check-in, check-out if you're a traveling nurse? What is it? So throughout the year or two, I've been compiling all of the policies that districts have created. And I've been taking some of their information just to support the school that I'm dealing with so that they are not starting from scratch either. Margaret?
This isn't exactly, it's going back to, I think it was Stacy talking about people having to be revived with 3 doses. So in the chat, I was just uploading in case anyone missed it, that there's a new high dose Narcan that's out there on the market. And I was just, so 8 milligrams, I know what we give out is the 4 milligrams. And because of fentanyl and people needing so many doses. So I'm wondering, Giovanna, has Demas said anything about gradually switching over to that?
We were in conversation and I reached out to all of the EMS people that we have relationships with. And the issue with the 8 milligram, do you know what the name was of the 8? Melissa, I know. I was talking to Lee about it.
I know, I'm trying to see if it's in the article.
Daniela and Victoria?
Oh, Cluxado, that is the worst name ever.
Yes.
Oh my God,
it.
look, I'll put it in the chat. Look what it's called. What
yes, Cluxado. So in talking to the other EMS folks in our region, the state actually was looking to possibly transition to the 8 milligram because of the fentanyl issue. However, you can't just switch prescription and think that other people are gonna roll with it, right? So I reached out to EMS, and the issue is that EMS doesn't even have Cluxado on the EMS van because it has to go through the association, it has to get approval, all of this stuff. So and that means then hospitals would have to get approval, police departments, then certs, everyone. And that would really put a barrier in how we distribute naloxone. So that's why, at least for our region, I made it clear that no, we don't, thank you, but no, thank you. I didn't want others to have to go through hoops to at least administer a prescription that we already have. And you get 2 doses, right? So technically it is 8. And that was my rebuttal as well.
Oh, I thought it was a 4 milligram dose. In one of the nasal sprays, it's 4 milligrams. Is that what it
Correct.
is? Oh, and you get 2 doses.
You get 2 doses in the box.
Any thought of in the future giving 2 boxes per person instead of? No. Okay.
Not right now, but it is a good. I can bring it up to the state and see what they think. Louisa was telling me we spend millions of dollars just on Narcan a year, millions. And I just wonder how many of those millions get expired. Melissa, yes, right? That's a lot. It's a lot. It's $75 a box. If you go through the pharmacy and you don't have an insurance that is good, you could pay $120 out of pocket. So definitely something to explore, and I'll bring it up in our next state meeting and see what people are thinking, especially since there's that increase in fentanyl.
Oops, sorry guys. Okay, Any other questions or comments before we move on? I know that was a lot, but.
The last thing I did want to talk about was the Red Cross preparedness.
Oh, right.
Do any of you, can you unshare? Thank you, because I rather see everybody's face than the agenda. Do any of you work with your Red Cross in providing preparedness trainings to youth, adults, families, and organizations? No? Okay. Reason why I ask is because Caitlin and I presented to something ESQ 8, 10, 12, I don't know, but it's another meeting of many meetings that we attend. EFS 8. Do we know what that even means? I can't even think of what it means anymore. But really, it's individuals that are from social services, senior centers. You have people from Red Cross, from first responders, various different people, just talking about preparedness and prevention when it comes to fires, possible, ending in a pandemic and being in lockdown, things like that, and how to really prepare an individual, and talking about resiliency. And Red Cross does that, and they're free trainings. So they're looking to go into schools, possibly even coalitions, to talk about the different things that they can do. And I think that this is a nice stakeholder to have around the table as part of a membership to you all. Can you, Daniela, share the flyer that they have, just so I can go through the trainings?
Yes. Sorry, what I put in the chat, I'll have to
Support
send it
functions.
after.
So this group, emergency support functions, is even though they're regional, they are statewide as well. Different individuals lead this type of emergency meeting. But the emergency preparedness training for your community, I think, is a really nice addition to what we're talking about. So the disaster and emergency preparedness for you, sorry, I have comments coming up and I can't see. So prepare with pages. So there's different curriculums that they can go through based on the grade level. They also have training for organizations. Just something I think that we should be aware of. I wasn't aware of this stuff, so when I had to reach out to Eric is his name, who really shed some light on all of the information that he does do. They do provide various trainings, whether they're free or not, but I'm hoping that some of you will be able, you can reach out to me. I'll be happy to give you their information, to possibly even invite them to your coalition to talk about the different projects, especially those that are school admins, or at least teachers, health teachers. Maybe this is something that they would like to offer next year in their curriculum, health curriculum, something. Can you go down just, is there anything else?
There was just one other.
Oh, the Stasia's number is down at the bottom of that flyer. We'll make sure to follow up and have these two flyers in there, but that's the woman that you do want to reach out to, Nastasia. She's the person that I met with as well. But they are looking to do training to our region, but they're clearly having some issues because, as we all know, schools are, work in their own silos, and they have been getting their doors shut a lot lately. And they're hoping that maybe we can help them open those doors. Margaret?
This was reminding me of, you know, how I think probably all of us, our kids do the Red Cross babysitter training, that like the CPR, all that stuff. And so Diamond and I did a Narcan training at Center for Global Studies recently, which is an interdistrict, you know, high school. And there was a student who attended the Narcan training, and she was like, you know, I've got that babysitting training under my belt, but I would love to have some kind of like certificate showing that I'm Narcan trained that I can show parents when I go babysit. So I think Diamond and I talked about just ordering a bunch of like wallet cards that, you know, said I'm Narcan trained, but I realized like, oh, let's share that idea that maybe whenever we, you know, it's so cheap to buy a bunch of wallet cards. Maybe the hub could design one that just says I am Narcan trained. And when we do the trainings, we hand them out with the kit. I don't know how much adults care, but you know, or we write the date of the training right on it. So if people want to get retrained or show their job they're trained, but if we work with Red Cross and we could get them to do Narcan training for the kids as part of the babysitting training, I thought it was a great point that this high schooler made. I would never have thought of that.
When I was looking at, I'm sorry guys, I got bad allergies. When I was looking at the card, I had left the date part blank and the name. And then if you wanted to leave like a signature part, whoever did it, whether it was me or Margaret or, you know, you guys, you would sign there, just write effective, whatever, because it's not really like CPR, you know, you have to go. Effective, whatever, the day of the training was, and then just write their name. It was like kind of with our logo or the hub. If the hub made one that was general for everybody, then maybe it could be the hub logo or whatever. But if you did it for your thing, then you could put your logo in the hub and just leave those dates blank. So it was like not something that we had to print every time we did it. It was just a little card we could have and fill it out.
I thought you had to be 18 to be Narcan trained, because I felt like someone asked last year, and so babysitting, you could be 12, right?
I think you can't get a kit unless you're 18 or over, but you can be trained. Like,
You can be trained.
But then, so you could, so if you're trained at 12, so let's say I'm the parent, but I have a 12-year-old that's trained and I'm the holder of the Narcan, I could give it to that 12-year-old to administer. I just seem like it doesn't seem to make sense. Like there's a disconnect.
Well, you could do it like just as training and recognizing an overdose too. Like we did,
Okay.
we trained high school kids in recognizing alcohol poisoning or a drug overdose and how to respond. And the reason they need to call 911, and then anyone who was 18 and over got a kit. So you could like do the recognition piece.
I thought it was 16 or up. Maybe I was confused. I thought on our last call, Margaret, did someone say it was 16 up? Like they've done 16?
As we're having this conversation, I'm like, I don't remember what we said. I couldn't remember if it was 16 or 18. I will say the girl that brought this up came to our training that was all adults. She was the only kid, and she was there because her best friend's brother died and nobody had Narcan on site. So we didn't, I think she was a junior, but we gave her a kit. I mean,
she was 17 if I'm not mistaken.
Let's make it clear. Let's make it clear. 18 and older to receive a kit. However, I've had a couple of kids under 18 come to me after the training and say, I'm not 18. However, I have a mom or a brother who is struggling with addiction, and I'm here to possibly save them. Sure, here you go.
Yep.
Yeah.
No questions. There's no questions about that then, right? The person clearly is mature enough to attend the training because they want to make sure that their loved one stays alive. Sure, not a problem. So I think.
So quick question.
So I think it's up to your discretion. If you think if you're training a youth and you're like, I don't know if this person is mature enough, or if you're feeling a certain type of way, then fall back on the rule of 18 and older. But anyone can get trained in it to recognize. Absolutely.
So we were having the conversation in our coalition. because, we have the Norwalk Star groups and the 2 high schools with the kids. And I want to say it came up where like maybe certain kids in the school were trained, and also because not every teacher is, yes, all the nurses and the kids in my school-based health center. But after that incident where the kid zoned out here at McMahon, and then they heard about the fentanyl in the other school, we had talked about having kids who were trained in the building. Would that be something that we could do? Or, I mean, even if the teacher was the one that was holding it in the building somewhere, they knew where to get it. I'm just trying to think like, would that still work with our group? Remember, Margaret, we were talking and having the group of kids be trained and like
Yeah,
a
it was
safe
that,
zone
it was
of
that
school?
EMT who wanted to have a group of kids that were like, but I thought it was also sort of on the suicide front and other stuff, but just having kids that were sort of internal mini first responders. Because
Right.
it's true, like we had the 3 kids go to the hospital after passing out from vaping really potent THC. And, some of their friends went and got help and some of them clearly did not.
Yeah, so I mean, some are still. I think one of the kids got caught again, maybe like whatever, confiscated. So I'm just thinking in that sense, like if it's 18 or older, would that be an exception if they're kind of like it's not just Narcan, it's CPR and QPR?
Well,
Would
and
they be able
maybe the
to-
question, Giovanna, to bring up too for the state is, this is the year where all the high schools have to start implementing those pathways and capstone projects for high school students to graduate. So some schools started early and some schools didn't, but by next year, if you're graduating, you have to have it done at capstone and you have to have a mini pathway. And so a lot of schools, I mean, I know at least in Norwalk, the different schools are looking at having or already have pathways in that are health related. And one of the concepts is if you're doing a pathway, you're supposed to try to get some kind of certification if possible, because one of the goals is that you graduate college or career ready. So you're going to have these kids who are becoming like EMTs or paramedics or whatever while they're in high school. And so they don't have to complete it, I guess, until they graduate, and they might be 18 by then, but it might be worth the state revisiting, like, is 16 an okay age for this just across the board? Because, I mean, a 16-year-old can handle Narcan.
Thank God I graduated from high school already. That's all I got to say.
Oh, listen, all of us,
Capstone
right?
in high school? Please.
Seriously.
I would have dropped out. Bye. Bye.
Right. First, if you can survive COVID, now let's just throw a whole thesis kind of project at you.
Exactly. No, thank you.
So I have another question. Is anybody working with the universities? Like, are RAs getting trained in Narcan? Like, do you know if any of the local universities have Narcan as part of their protocols?
We have trained security guards at Housatonic, and I want to say Sacred Heart or Fairfield U. But this
There's
was
also a training with University of Bridgeport security guards.
that's
And-
scratch Sacred Heart and Fairfield. It was easy. Sorry, I had it. I can't think of everything. I can't remember everything.
I'm just wondering about an Allegra. I don't know if you know, in Darien, there's that post, I can't remember the number, 57, but it's all high school kids, right? That are EMS trained and they ride along with EMS. So I'm just wondering what happens with them. Do they get to, do they get to administer Narcan, or I don't know.
I don't know the answer to that, but they do. I mean, they're on the ambulance when they're 16 or as soon as they finish their EMT class.
So that's the thing, though. They're not getting Narcan from us, though.
Oh, okay. I see what you're saying.
So however EMS gets their Narcan, they have their own policy and protocol and age limitation. DEMIS sets this limitation on us.
And if you think about it,
Doctor.
DEMIS really starts working with people over 18 and all their treatment. So that's probably, they're just thinking of it that way. Maybe it's something to just bring up with DCF and go, you guys, can we, actually, so Giovanna and Melissa and I and Ginger are going to be doing a kind of, have been asked to do something for the Commission on Women, Children, Families, Seniors, Equity and Opportunity. It's the longest name ever, something like that, but it's about marijuana and opioids in kids and keeping them safe and sharing some of our data. And it's later this month. It's with the intention of getting ready for the next legislative session. So why don't we bring that up, you guys, as part of it is, you know, let's remove this artificial age barrier.
Yeah. Great. So yeah, so we'll follow up with Red Cross. I'm actually thinking possibly, if not over the summer, maybe over the summer, have them come and do just a virtual session so everyone can hear what they do, and if you decide, you can bring it to your own coalition and see, or invite your coalition to hear what they have to say. But I think it's more for us to be spread awareness and education that they are around and they are doing things for free, and they're well known. So why not get them more involved in the work that we are doing? Because when we talk about resilience, right, we talk about resilience when it comes to suicide and unsudden deaths in our community, and making sure that, you know, if there's a youth that is struggling with something, how do they become more resilient? This is something, right? There are kids that are out there that possibly are scared, you know, because they don't know the unknown, right? Let's prepare them to learn about certain things that we should be all keeping track of. House fires, fire alarms, things like that. And I know this is out of our scope, I know, but it is connected. Some way, somehow it is connected. And I just wanna make sure that we're all working together. And they're a great coalition member, so why not? And that's it. Daniela, for you.
Great, thank you. Okay, so for the sake of time, we'll move on in the agenda. Next, I just wanted to get into the vaping initiative and marijuana, more just for the sake of time, kind of jumping down to, if I wanted to see if there was anyone in the region or each town, if they were aware of any vaping and tobacco cessation programs in the region, but that are also programs for marijuana. I'm not sure if anyone has seen anything for that or know of anything. I
You
know
mean treatment programs?
Yes.
Are you asking about
And
treatment
like, yeah,
programs?
for people who are trying to quit using marijuana. You know, we've been doing some research for our resource guides and things like that, and we haven't really found anything. So I was wondering if people have heard of treatment places or programs now expanding from vaping and tobacco to include marijuana.
I think Karen has something, CARON.
I mean, we have something for Trumbull residents out of the Mary J. Sherlock Counseling Center, where one of our LADC went and completed a program in, I think at UMass, which is a vaping cessation program for young people. And she herself has expanded it because most of the kids she was seeing vaped both. So she has kind of taken it upon herself, but that resource is only open to Trumbull residents. But if anyone else in your towns wants to connect with her, I can arrange that.
Sure, that'd be great. Thank you. Okay. Hopefully people will start including that more as well, because yes, a lot of youth are vaping marijuana. Next, we also wanted to see, I know Caitlin is kind of here, but she's not feeling well, but we're curious to see how you guys would feel about doing a marijuana lunch and learn. I know there have been a lot and a lot of presentations, but is that something that you're interested in? Possibly maybe sometime towards the end of this fiscal year or starting off next year with that? We can always discuss further.
In terms of just general information about marijuana, or what kind of training were you thinking?
Good question. Caitlin, I don't know. I know she had been doing some research, so I don't want to give false information.
Can you
I can
repeat
always.
the question? Sorry.
I was just wondering what kind of marijuana lunch and learn, like what would be the topic?
Oh yeah, so this is the reason why we wanted to bring it forward is because there's been so many different kinds of marijuana or cannabis workshops happening and speaking engagements and such. And this was on our list to have for a little while, but now we're just kind of feeling out what do all of you or what would all of you be interested in? And if not for this fiscal year, then maybe next fiscal year. In what you want to do around marijuana or what you want to hear around marijuana, because I know we've all been doing a lot of that work. So we are posing that as a question to all of you.
This is Ina. I think next in the new fiscal year will probably be good to kind of start afresh, because we're just really, I know for us in BUC, we've done a lot of training with marijuana and cannabis, the law in marijuana, the THC, the in gummies in particular, along with the vaping and the different levels and quantities of the vape that they're using and what's being offered, and it goes on and on and on. So for me, I would think that starting a new year would be good. Enough information and enough trainings that have gone on that I can wait.
Yes.
I think the one.
Just saying.
I agree too, but I think maybe next year too, getting an update on whatever new research is out on marijuana and the learning, marijuana and the brain.
Right.
I think drawing that line for parents and community members on how this is impacting like educational outcomes is going to be a really important role for us, because nobody else is talking about it. So maybe getting some information on that, because there's new research all the time, right? But it's like keeping up with it is really hard.
Yeah, absolutely. I agree. And thank you, Melissa. Thank you, Ina. So we can definitely plan it for next fiscal year. I have marijuana in the brain, marijuana and education outcomes, just an update on the research. And if anyone would like to see something else closer to the time, just let us know. We'll start putting that stuff together and keeping track throughout the summer.
Just to add real quick, Caitlin, because I know in Fairfield, they put a moratorium on addressing commercial cannabis in town until next February. So any information around municipal policies or prevention of commercial cannabis strategies, that would be helpful.
Okay, got it. Thank you, Kathy.
I'm just sort of thinking how, like from an efficiency standpoint, that there are a lot of updated webinars coming out all the time from like the Prevention Treatment Task Force, I don't mean T-TAS, I mean like the New England Prevention, whatever, training center, and maybe T-TASK and some other things. So I think like it might be that you don't have to create something new, but just sort of track who's already coming out with updates on a regular basis and put together, like if you guys review the top 3 newest webinars and you're like, okay, this is the best one, then we don't all have to go watch all of them. And then what I think the value add would be if maybe DMIS prevention overall, or you guys or T-Task or somebody statewide just creates an updated slideshow on like, and this is where we are in Connecticut right now, because we all probably have slideshows around what the cannabis law says right now, but then there's already bills that have gotten out of committee, so it's going to be different by the time the session's over. So I'm just thinking like some of this stuff is happening and other people are doing it, and like, you know, why not get whatever somebody else is doing and then just bring in the parts that are missing that are local.
Great
or state
point. And I
specific.
think even all those New England Technical Center, they record every one of those and send the recordings and the slides out. So you could just maybe just put those recordings on the Hub website and drive us to them instead of having to create your own presentation or your own training. I think that's a great point, Margaret.
Agreed. Yeah, we're not trying to reinvent the wheel or do anything. We all know that. So we're just keeping track as much as we can with all of these different ones coming out, sharing out what we like best. And maybe instead of sort of us creating a PowerPoint that's just repeating information you already know, for next fiscal year, it can be more so of a meeting early on in the fiscal year to plan out what everyone has ideas about, what's like Margaret and Melissa said, the new policies and such with new bills coming out, what does that mean for us? So it'll be more of a conversation, I think, instead of just repeating information a lot of us already know. Great feedback, thank you.
Yes, thank you, I agree. Okay, next on the agenda, we had earlier, I'd say a few weeks ago, Caitlin and our intern Christina had sent out a Google form on behavioral health trainings. We were trying to gather a list of speakers and what trainings are happening in the region. I am going to reshare the link. We made some edits just to give to you guys to see what is going on in the region. We know, you guys do Narcan training, some do QPR trainings. We're just trying to gather all of that information because we do get requests all the time, but this way we can have it compiled in one list so we know if we get certain things that we can just refer everyone to those people. So I know we might not have a lot of time, but if you have a second to just fill this out now, or please do so as soon as possible so we can just compile everything. We'd really like to have this for the next, fiscal year at least. Okay, so I know some people had to jump off, but you can save it. I know you may also have to talk to other people in your coalition just to make sure. Just wanted to give you guys a couple of seconds to look at it. I will also resend the link in the follow-up email. Last on the agenda, we have National Prevention Week and May, which is Mental Health Awareness Month. So for the month of May, we are going to do a calendar of events, again, that the Hub has previously done the last couple years. I will also be sending out a document that you can fill out. We would like to gather all the information by April 25th, so I can add it to the calendar and everything will be there. You can fill out the information as well as I know last year people forwarded their flyers, so we can do that too if it's a virtual event, so we can hyperlink it. This year, National Prevention Week's day themes look a little different. We weren't expecting it. We thought it was going to be like every other year where there was the focus on vaping and nicotine and things like that. I will quickly read the day. So Monday will be strengthening community resilience, substance misuse, and overdose prevention. So that has stayed the same. Tuesday will be preventing substance use and promoting mental health in youth. Wednesday will be preventing suicide. Everyone plays a role. And then the rest of the week looks a little different. Thursday is going to be the talent pipeline, enhancing the prevention workforce. Friday will be prevention is everywhere, highlighting efforts across settings and communities. And then Saturday will be celebrating prevention heroes. So for that, we were brainstorming some things at the Hub, and we were wondering if you want to maybe possibly just send a little blurb, or we can have another meeting on highlighting specifically what the LPCs do. We would like to highlight the work that you are all doing. It's important work, and we want you to be able to be recognized for that. And I think that would go well with the daily themes that they have. We also want to see if there's maybe one or two people in your coalition that we can highlight as a prevention hero. You know, maybe just giving a little blurb that we can share in our newsletter and post on social media. I don't know what your guys' thoughts are around that. I know it is April 8th, but we're hoping for a quick turnaround. We have about a month. Is that something you guys would be interested in doing?
Daniela, I'm sorry, I don't really know what you're asking because you listed all the days and what
Oh,
are you
sorry.
asking us about?
So we just want to highlight one, we'd like to highlight each of the local prevention council. So what, you know, just giving us a little blurb of some of the things that you've been focusing on. And then there is a day for prevention heroes. So for that specifically, we were wondering within each LPC, if there's one or two members that you would like to highlight specifically within your coalition.
That's nice. So we would just email you what we're doing and the names of a prevention hero from our communities.
So I guess
Yes.
for right now, it's for you to think, right?
Mm-hmm.
Thinking about National Prevention Week and the themes that are happening this year, which are not your typical, right? You have suicide, you have mental health, and you have something around opioids, but the last 2 days are really focused on prevention and the world that we live in when it comes to what we are doing and how, you know, we're representing a hero. In my eyes, we're all heroes, right? All of your coalition members are heroes. They all come to the table every month or 4 times a year. So thinking about the last 2 days of National Prevention Week, what do you want to highlight and all of the work that you're doing? National Prevention Week statewide event is in Bridgeport. As always, the state looks at Region 1 because Region 1 has always been up to high standards when we do National Prevention Week. And Margaret, you know, we started this out with Danique, and we're continue to thrive. So now that Thursday and Friday of National Prevention Week is about enhancing the prevention workforce and also highlighting efforts across the communities, or excuse me, and celebrating prevention heroes. What do you want to display? What do you want us to highlight? We're trying to get something together, maybe even if it's a video, and this is not for you to do, it's for us to do, but we need your help. We need all of your help to get this completed. So highlights of what you've done across settings and communities. If you don't want to just highlight one person in your coalition, do you want to highlight all of them? What is it that you'd like us for us to do to highlight? Because I think this is a great way not only to show what the region, how we all collaborate, but also showing the state all of the great things that you have been doing, because they don't know everything, right? So what is it? And I think that having an email sent to Daniela saying some of those things is going to be really helpful.
I always think it's great when we get the opportunity to highlight someone who is working really hard for us, and maybe they're volunteers, or maybe it's something that's not normally part of their quote unquote job. But I love that idea. I also think it's really important to highlight the regional campaign of You Think You Know. The bang that we're getting for our buck is really important. Showing how we can pool resources and collaborate and work across town lines, I think is really important. Same with also, you know, a lot of us are doing the mention prevention. Like, I think focusing on the regional stuff, the bigger campaigns, is also helpful.
Absolutely.
So anything else besides those regional campaigns, if you have something specific, send it to Daniela so we can highlight that, as well as.
Are you guys able to pull numbers from all the data we provide you in terms of like how many people these 14 LPCs have reached, you know, that kind of impact numbers?
I wish. No.
I know it seems like a lot to ask, but at least you could, you know, you do have numbers in terms of like how many Narcan kits we've given out, or, you know, some of those quantify. It's hard to prove. I mean, it's the challenge we all have, right? Like, it's hard to prove a negative. We can't show how many kids didn't get hurt from drinking, or didn't, like, you can't necessarily show that, although we have, some of us have great data. But any way that we can show the number of people we touch, I think is always helpful.
And that's not necessarily something that we have unless you reported it through your demographic forms.
Right.
So that's why I'm saying, if there's something that you want to highlight, so say for example, maybe this past year, Melissa, you know, a post showed an increase in impressions because of the content, and it was something that was just it was an outlier, right? We want to know that. What is that? What was that number? What was that post? Maybe even taking that post so we can then put it in some type of video format or PowerPoint presentation format so we can highlight that.
So do you want to highlight? Do you want like our top 3 highlights from every coalition, or like what we're most proud of? I mean,
Top three,
That would be good.
again, everyone is different, so I don't want to throw something on your plate if you don't have it, right? And that's why I'm trying to be as big as possible because
Yeah, I think we're all just trying to figure out, we all have so much reporting we already have to do for our various funders. So it's how quantifiable do you want us to be? I mean, for some coalitions, it's going to be, hey, we got more money, you know, like, hey, we've got more members, or, you know, hey, we're working with the schools in a way we never have. So I guess the question is just to make it easy for us. Like, I know you're trying to be vague to help us be creative, but you know, we need to tick the box too. So
it would be anything, so it could be Fairfield Cares, right? Got DFC, Darien, DFC, that's a highlight, right? This past year. Maybe a coalition, Easton, highlight Easton. Easton had their first Easton Coalition meeting yesterday, and they're not here, but they had a successful Easton meeting yesterday. So that's something that I know we're gonna highlight, right? But would it be, what was part of your work plan, or at least your strategic plan that maybe you have accomplished this year? So, you know, some people are, you know, New Canaan and Westport and Trumbull, you guys have private schools. Were you able to get in there? Is that a highlight for you? I don't know. In my mind, that is a highlight, but maybe in your eyes, it's not. So that's why I'm just trying to be as big as possible. You know, for some people, freshman forum, Margaret, you guys completed your first freshman forum this past year. Others have not. Stratford struggled the last 2 years. How did it go this year? Maybe you want to highlight that, you know, saying, you know, post-COVID, we had the best freshman forum of all the years we did. I don't know.
Yeah. Okay.
Does that help?
Gee, I'm just thinking if we, and maybe it's just you chat with Katie and let us know, like, what, you know, like, how do you think you're going to end up disseminating this? Because then we know, is it like bullets? Is it a paragraph? Is it going to be like each day there's a different LPC, so you want a little more, or is it going to be aggregated? So that, because otherwise I'm also feeling like you're going to get so many different things, it's going to be a nightmare to decide how to compile it. So maybe if you guys go, we want it, it's really going to be 3 different blog posts, and one's going to be this and one's going to be that, or it's going to be statistic of the day or tweet of the day or whatever, then we can.
It's going to be a little bit of everything. No, I'm serious. It's going to be a little bit of everything. So I may, you know, depending on, say, Margaret, say you're like, oh, we did so much this past year in Norwalk or in Westport, you know.
I can't remember what we did yesterday, though.
No, but I'm just saying, maybe you have a little bit more. So you know what? I may say, let's do a blog post for yours, but maybe in Monroe, they had a couple of bullets. Maybe I'm just gonna highlight them on social media, tagging them, having their logo, things like that. So it all depends on what information I get. And then that's when I'll be able to, at least the team will be able to say, okay, based on this, let's do it this way. And of course, with Katie's eye, you know, she's great. So she'll be assisting me.
She is great. When you should give us a deadline.
Yes. So the deadline, Daniela, you know my date. I've been saying this date since yesterday, but it's up to you.
April 25th?
Yes.
Okay. Yes. April 25th. And that'll be for any events you're doing as well in the region. So that gives us a week to get it all prepared and put together.
And in terms of who we're thinking our prevention heroes are, like Diamond and I were just exchanging ideas in the chat about a couple from Norwalk, but do you just want their names? Are you going to need like a write-up on them? Can we be like, here they are, talk to them? What do you need for that?
For the hero piece?
Yeah.
So,
Like, would it be just like a 2-sentence, like, you know, here's Cadence and this is what you did.
Yeah, I would say, you know, one, highlighting that person. If you have a picture of that person, of course, that would be wonderful. But then also giving a couple of bullets on why they are a hero to the coalition. Can't think of the woman's name, Melissa, but the one, every time I feel like she's like the biggest cheer, the blonde, short-haired woman.
Lori Hayes O'Brien, my
Yes.
personal cheerleader. She goes
My
with me
God, she
everywhere.
got your back. Let me tell you, nobody better mess with you because I think she'll beat them up.
She will. She'll take them down. But yeah, I take her everywhere. I take her to the Board of Ed, Town Council. Like,
but I think, you know, when I was thinking about the last day on Friday of being a hero, I thought of her.
yeah.
I said, you know, what are some of those bullets that you want? Not only the town already knows, you know, that hero, right? But it's the region, it's the state that I want them to recognize those people that are at the local level that are doing that shit. That's how it goes, you know. It is what it is. So what is it?
Yeah.
Did they have a gesture? Did they, you know, did they, I don't know, advocate for change, an environmental change within your town, within the coalition? What is it? Bless you.
Yes. And with that being said, as Giovanna had also mentioned, the actual National Prevention Week event is going to be held at the Discovery Museum in Bridgeport. We had limited tabling, but we will have representation from Fairfield and Bridgeport LPCs, but all are free to come. I will send in the follow-up email. We are getting tickets. So we would like to open it up to you guys first so we can have those tickets aside for you so you can come for free. We have a ton of events lined up for the day. There'll be gizmo readings. There's going to be some other therapy dogs. Each table is going to be doing different things. There's the museum itself, of course. We're trying to also get some commissioners to come down and make an appearance as well. The event will be from 10 to 3-ish, around there. But there will be the first sighting of Stella, the mascot, the National Prevention Connecticut mascot. Yeah.
Wait, what does that mean? Do we have an actual starfish that's going to be there?
Oh yeah.
Yes.
We do.
Oh yeah.
Stella is real.
Oh yeah.
I'm sorry. I feel like Gizmo's got to be a lot cuter.
Gizmo
Like,
is
what
a
does
lot.
Stella do? She sits in a tank, right?
Hopefully she's gonna be in the corner screaming Stella. I don't know. Exactly. Exactly. So for anybody that, for you, if you're looking to attend the event and your family, we need to know how many people. If you have coalition members that have children that you know that would want and like to go to the Discovery Museum, please let them know. Let us know how many tickets. We're only asking for serious inquiries though. Clearly, I know emergencies happen, but statewide, we only received 100 tickets. And the other 4 RBHAOs, of course, aren't taking as many tickets because people are not going to come from, you know, the Rhode Island area or, you know, up north. So we want to see a lot of Region 1 families and friends and even new people come and just be able to enjoy the entire day. Mateo will be there in the morning time only though. So
I'm more excited to see Mateo than Stella.
You'll get to see him rock out in the morning time though, but once 11:30 hits, he turns into a pumpkin and he needs to go take his nap. but he'll be making an appearance.
Giovanna, I'm
love that.
thinking last year, Fairfield, Westport, and Norwalk, we made these feather banners that have all 3 of our prevention logos on there. Would we be able to put those up? Because that represents 3 of our communities, or even one of those banners?
At the museum?
Yeah, just wondering, like, in terms of, because you were mentioning how, like, well, and actually maybe they're planning on it. Fairfield's gonna have a table anyway. But we had a series of like 5 banners and they all have all our logos, but each one has a different prevention message on it. It might look nice coming into the museum or something.
Yes, that I will write that down.
Danielle is part of the committee. I stepped away, so.
Giovanna got out of it.
I miss it though. I love the committee.
Do
I
you
love
really?
doing it. You know,
I still have
my day.
I still have the baseball caps that Danique had at the office. Are they the same? Is it the same ones? Same colors, same everything?
The burgundy, yeah.
Yeah.
Mm-hmm. I gotta find that actually. I'm gonna bust it out and wear it that day.
I have a couple if anybody, there's like, I think 4 at Positive Directions and there's one of me. So if somebody wants an MPW baseball cap, I can give it to you.
Mm-hmm.
I will talk to the committee and see about those banners because I think that would be awesome. Because there's even, I haven't been there myself, but I know there's going to be a TV that's on the way to the cafeteria that's going to be playing messages and things. So maybe we can line them up even there on those walls. That would be nice.
Nice. Oh, that'd be cool. Thanks.
Oh, yes.
We have a feather
I
banner.
mean,
as
actually,
well.
if we want it, we have 15 total of the banners because each community bought the same set of 5. So we could literally have people like walking through an alley.
That would be cool. All right. I will talk to, yeah, I'll talk to
Just
the
make sure
committee.
that, you know, it's not a fire hazard, you know, and making sure that, because you could actually put it in the cafeteria area in all of the corners of the caf too.
Okay.
But I don't know what their protocol is.
Melissa.
Yeah.
Yeah.
See Melissa's. It's just gonna be like feather banners everywhere. Let's do it.
Yeah.
They take up no space, right? That's why they're so
I
great.
know. It makes it more fun.
Yes. And that'll be nice to see. Have some Region 1 representation.
Yeah, definitely. Okay. So if everyone can get heroes and highlights to Daniela by April 25th, this will also be in a follow-up email. Everything that we're going through today will be in the minutes.
Yes. Well, I see that it's 12 o'clock, so I want to respect everyone's time. Thank you so much. I know it was a lot. I will be sending a very lengthy follow-up email, but if you have any questions, please just reach out. We're always here.
Awesome. Wait, can I say one thing before we go? Because I saw Victoria hopped off and in the chat, I was like, she did her suicide update, but I don't think she remembered to mention there is a new QPR slideshow for anyone who is QPR trained. It is not different content, but it finally looks like it's not 1985 anymore. It's visually appealing. So log in as an instructor and download it. It's way better looking. Although I used it this week with a bunch of teens and there's some of the transitions, like I'm not quite clear on how to edit the transitions without messing up the graphics. Sometimes it's like the myths and facts come up together and you're like, wait, aren't we supposed to discuss this versus that? Or there's some things like that that maybe are editable, but it was time.
Yes,
Does
they
it
look
mention
really nice.
mention social media and stuff yet, or that hasn't
The
changed?
content is literally the same, but you know how
But
ugly those
It's not all white. It's not all white grandpas
Oh no,
anymore.
it's got like it's got like images and things slide around and colors, and it like opens with like almost like a video quality like sunrise, and it looks. I mean, I was doing the slideshow. I was doing the presentation for the training for
Sure.
teenagers, and I'm like, why would they ever have looked at those slides the way they were before, right?
Yeah.
Oh, here it goes.
Can you say it's loading
Yeah, but you
slow?
can't see. Yeah, run it in play mode so you can see it better how it. Oh
And
yeah,
it's-
we're viewing it in Canva. We're not watching it as a slideshow, but it has
Yeah.
everything like
Oh,
in
yeah.
one.
Yeah, it's in Canva, so I don't know.
Yeah.
It just looks a lot better.
Yeah. And things like slide in and out, and you know, there's all these built-in transitions that you don't see this way, but yeah.
Yeah.
Thank you, Hub, for all that you're doing to support our work. It's a shame the other two popped off, but you guys are doing a fantastic job.
Thank you.
Thank
Appreciate
you.
it.
We appreciate that.
Thanks, everyone.
Please reach out if you need anything, okay?